here is your question. All right, so if you have read and understood, considering 8 critical care scenario, kindly please tell me, how would you manage this patient?
I will manage this patient according to the critical care of surgically ill patient. As the patient is considering airway and breathing normal, and the patient is having hypertension, blood pressure of 70 by 30, and tachycardia.
Yes.
I will, and the fluid, the bolus of fluid, which is 250 ml, which is given 2 times. I think it is. I will start with the fluid resuscitation, and I will monitor the patient again.
Okay. Then,
I will monitor hourly in this patient to see the patient is improving, and then I will, if the patient is not improving, then I will shift the patient to the HDU, then for insertion of central line, and then monitor accordingly on the basis of central venous pressure.
what parameters would you follow in order to make sure that patient is improving?
I will check the okay, peripheral. I will check the pulses, peripheral temperature of the patient, as well
Yes.
as blood pressure of the patient and urine output of the patient.
Yes. And
And I'll also measure the capillary filter time.
okay. Yes. What else would you do? Do you
And
think this 250 ml of bolus, which was given twice, was enough, or was it more than enough? Or kindly discuss the amount of fluid which is
yes,
given.
the amount of yes, the amount of fluid which is given, it is inadequate.
Yes.
I will give more fluids to this patient to succeed with five at the rate of 500 ml over the 15 to 30 minutes.
Okay. Then,
Then reassess the patient
yes.
accordingly after hour on an hourly basis.
All right. Okay, just suppose if you're managing the patient, okay, you said hourly, all right, because managing the patient, okay, why would you recommend to observe the patient hourly?
Because the patient, first of all, the patient is a post-operative, and there may be bleeding inside because of the surgery, and it could lead. It might have led to hypotension and tachycardia. The first thing, and the second is I go to constant monitoring of the vitals, whether the patient is improving to the fluid challenge or not. So that is why I have to monitor the patient hourly.
Okay, who would you involve or who would you inform about the patient dropping blood pressure or the patient's fluid charts? Who would you consult?
I will concern with the operating consultant who has done the surgery,
Okay,
as well as I will also discuss with the anesthetist
yes.
who
And
will uh,
what measures would you do to take care of the patient's vitals?
if yes, I will first of all start the flow resuscitation with the fluids, and the patient is not responding to the fluids. I'll convert. I will start inotropic support also,
Yes,
and I will do yes, start the inotropic support as
yes.
well as then again I will monitor and assess whether the patient is improving or not.
All right. Okay. Can you tell me what are the What are the most likely causes of hypotension in this patient?
In this patient is first of all, I will consider that the amount of fluids post-operatively it is inadequate. I will resuscitate the patient. I will start the crystallites. Second, I'll keep in mind that it may be due to the bleeding from the surgical cause maybe.
Surgical site, okay. Right. Can you tell me which fluid is a better choice to give as a maintenance fluid?
I will emphasize on giving the Ringer's lactate
Yes, why?
post-operatively because it contains that electrolytes as well as lactate.
Can you compare the composition of Ringer lactate with the normal saline and tell me?
Yes, yes. In Ringer lactates, the amount of sodium is in Ringer lactate it is 134, and in in it in it in NS it is normal saline it is 154 millimoles per liter, and in Ringer's lactate the amount of chloride is 109 millimoles per liter, and it is not present in 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 case of that
Ringer
normal
lactate,
saline.
okay, normal saline is given along with the potassium.
Yes.
So does it have any advantage over Ringer lactate when it's given like this or not?
In
What about the osmolality of the normal saline or the osmolality of the Ringer lactate? How would you discuss that? What is
so
osmolality? Can you define the terminology?
It is more iso. It is
Yes,
more.
it's isosmolar. Normal saline.
Yes, it is
Whereas,
more osmolarity than Ringer lactate.
yes, but terminology you can tell me later, okay? All right, can you please tell me what is exactly the purpose behind giving the fluid therapy to the patient, to this particular patient? Can you give me 3 reasons, please?
Yes, I'm not now able to hear you.
Yes,
Can you
can
repeat
you
the question?
yes, can you please give me 3 reasons why or what is the purpose of giving fluid therapy to this particular patient?
Yes, to increase the intravascular volume of the patient.
Quickly.
And first of all, yes,
Yes.
and increase the blood pressure of the patient, and it is a post-operative case.
Yes. And
To increase the cardiac output of the patient.
cardiac output, all right. How would you calculate the blood pressure?
Blood pressure it is a byproduct of stroke volume into the heart rate.
Stroke volume into heart rate. Okay. What about blood pressure equals to cardiac output into total peripheral resistance as well? So you said you've given me 2 reasons because you said to increase blood pressure and to increase the cardiac output as well. So cardiac output
Yes.
is the result, like a cardiac output plus or the multiply by the total peripheral resistance increases the blood pressure or makes the blood pressure.
Yes.
So it
Yes,
is
sir.
1 point. And then second was because it's to replace the fluid electrolyte bell vent, right? Okay. And
Yes.
the third point would be to satisfy the need of patients' basic needs of water and electrolytes, right? And if patient might undergo in shock because of low blood pressure and all that, so it will help in increasing the plasma volume and improving the tissue perfusion. So it increases Am I back?
Yes,
Yes, ma'am.
ma'am.